Want to get to a big update this afternoon on the coronavirus fight in New York. Today, Mayor de Blasio announced his initial plan for vaccine distribution starting in less than 2 weeks.
The first doses of the Pfizer vaccine could arrive in 12 days. Then the Moderna vaccine could follow just a week later. So who goes first? The mayor says healthcare workers and people at nursing homes will get the first shots. This comes as the state positivity rate is close to 5%, and today hospitalizations reached a level that we really haven't seen since May. News 4's Andrew Siff kicking off our coverage. He's live in Greenwich Village. Andrew?
Right, David, behind me you may be able to see the line of folks waiting to get a COVID test here. You've seen sites like this all over New York City, and a lot of these folks sure would love positive progress on the vaccine arriving in New York. Today we heard from the mayor that it would be, as you indicated, those frontline workers. They could do it by appointment. They're coming up with a distribution schedule, and the vaccine arrives 12 days from now. The COVID surge in New York hitting close to home.
It's not looking good. I mean, my daughter just tested positive.
This Manhattan dad hoping his other daughter is negative as the family and the city anticipates a vaccine.
I think it's great news. It's, it's hope. We can see the end of the tunnel.
Mayor de Blasio confirmed today not only is the first batch of Pfizer vaccine set to arrive December 15th, but in the month of December, more than 465,000 total doses are expected in the city. A little more than half from Pfizer, the rest from Moderna. The priority, healthcare workers, nursing home workers, and residents. In a city of 9 million people, the first doses only begin to ease the crisis.
The health department itself currently has the ability to receive, store, and ship up to 320,000 doses of ultra cold. That's at minus 80 degrees Celsius, as well as millions of frozen vaccines.
But before immunization comes a harsh realization. The city's rolling COVID positivity now above 5% and climbing, with schools set to reopen on Monday.
It's quite clear at this point that this second wave, unfortunately, is right upon us. We are seeing a different reality in the hospitals for sure than in the spring. The ability of our hospitals to deal with patients is greatly improved.
Back in the testing lines today, New Yorkers now navigating holiday plans and government advice to reconsider. Jessica Sturtzer seeing her family.
I don't think I'm in one of the priority categories, but if that were true, that gives me optimism, yeah.
And now take a look at this. This was in Albany within the last hour. Governor Cuomo opening up a box from Pfizer, demonstrating the cold storage involved, the dry ice packaging involved in the thousands of vials that will be arriving for those first doses, which are due in New York by December 15th. More from the governor coming up at 6. Meanwhile, the mayor said the city's database will be keeping track of who gets those first shots, because remember, even these first responders need a second shot to make the vaccine effective. Live in Greenwich Village, Andrew Siff, News 4 New York.
All right, Andrew, a lot of great new info there. Thanks for that. I want to get to Storm Team 4 now. Beautiful shot here on the left side of your screen. Sun setting on what was a gorgeous December day, but there is a storm on the way. It could deliver a triple threat of rain, wind, and snow. Let's get over to Storm Team 4 meteorologist Matt Brickman in for Dave. Hey, Matt.
Hey, Nat, the reason we've got that beautiful sunset tonight is because clouds are rolling in. That is ahead of this storm, which still has a ways to go. Way down coming in off the Gulf Coast now and should be arriving late tomorrow. I think we'll probably be dry for most of the day on Friday, but late Friday night into Saturday, that heavier rain arrives and some stronger winds. Now, most of us should just get rain, but north and west and certainly in higher elevations, you've got a better chance for snow. Go ahead and look at some of those spots, and it's mainly upper northern New England where you're seeing any sort of significant snow accumulation in those higher elevations in the mountains. For us, I think we're looking at a couple of inches of rain, which certainly could lead to some street flooding in those flood-prone areas, and with those stronger winds as well, certainly making a mess of things through the afternoon. Now, again, timing on this is going to be late on Friday through most of the day on Saturday. Coming up here in just a little bit, we'll walk you through the path of this storm and talk about the cooler air that follows it coming up in just a few minutes.
See you then, Matt. Thank you. Today, New Jersey set a record with more than 4,900 new cases in a single day, and there are more than 64 deaths to report. The number of people in the hospital also climbed today. And because of the surge in numbers, Governor Murphy urging you not to travel out of state unless it is for essential work. Now, this comes a week after the state scrapped its original travel advisory. Travel to neighboring states, including New York and Connecticut, is still allowed. All of this as we're learning more about 2 coronavirus outbreaks at New Jersey medical centers. In Brick, more than 100 employees have contracted the virus, and in North Bergen, dozens of hospital workers have tested positive. News 4's Chris Glorioso is live at Palisades Medical Center with more. Chris?
Well, things were bad enough here at Palisades Medical Center at one point that they decided to divert ambulances away from the hospital because of concerns about staffing levels. Now, those diversions are over, but the hospital still has not said exactly how bad this outbreak was, and that is raising concerns about transparency.
Very alarming to us. Very, very alarming.
Debbie White represents 13,000 New Jersey unionized healthcare workers, and she says the recent COVID outbreaks among medical staff at Palisades and Ocean medical centers are serious matters. White told News 4 between 30 and 40 healthcare employees contracted COVID at Palisades, and she estimated more than 100 got sick at Ocean Medical Center.
But it's very alarming to us to hear that there is a surge, there is an outbreak at Palisades. We've already had 2 members die at Palisades Medical Center in the first surge.
The Hackensack Meridian Health System has not confirmed the numbers of currently infected employees at either hospital. The lack of transparency, something Governor Murphy was asked about at his Wednesday briefing.
Do I think we should share information on hospital outbreaks? Yes, I think people should know that. I don't know why we wouldn't want to do that. We do it with schools.
A bill in the state assembly would require hospitals publicly report coronavirus disease data. The governor said he's supportive of the concept, but wouldn't comment on the bill itself. Meanwhile, Hackensack Meridian Health reporting staffing levels improving, and only 1.5% of clinical staff system-wide are infected. Ambulances no longer being diverted to other facilities. Earlier this week, a spokesperson said the outbreak at Ocean Medical was consistent with the increase in community spread of COVID-19 in towns and hospitals throughout New Jersey.
The new workers' comp law presumes that any healthcare worker who contracts COVID-19 has done so in the workplace, not in the community.
The union called that a reckless presumption. A statement from Hackensack Meridian Health today said there are adequate staffing levels here at Palisades Medical Center and throughout the hospital system. Also pointing out that although there was a brief time where they were diverting ambulances here, they say that's not that unusual. Even pre-pandemic, there are times where hospitals get overwhelmed to some degree and try to take a pause and divert ambulances elsewhere. The hospital says it is taking extra precautions to cut down on the risk of infection, including more contact tracing and some new restrictions on visitors. For now, reporting live in North Bergen, Chris Glorioso, News 4 New York.
All right, Chris, thanks for the latest. Let's go to Connecticut for the latest now. Governor Ned Lamont just beginning his coronavirus update here, and he's talking about the vaccine. He said he's going to update that, and my producer just telling me the positivity rate jumped to, what was it? 7.13%. That number just coming in there. Hospitalizations also have gone down, they're saying now, and they're also those numbers we're going to monitor through this news conference. We will update you much more as soon as we get a chance to listen to it play back, Ush.
And Natalie, there's some concern when we look at the national picture as well. The U.S. has reached several new unwanted records in the fight against COVID-19. There were 2,777 COVID-related deaths yesterday, and that's the most in a single day since the pandemic began. There were also more than 200,000 COVID infections. That's the most in one day. And right now, 100,000 Americans are in the hospital with the virus. The White House Coronavirus Task Force says the nation is in a very dangerous place, and anyone over 65 or at high risk should not go inside a public space where people are not wearing masks. As numerous polls find many Americans are skeptical about getting a COVID-19 vaccine, former presidents Barack Obama, George W. Bush, and Bill Clinton say once the vaccines are approved and available, they will make themselves publicly record it, or they will get themselves getting the vaccine and record that publicly to share it as a way to build confidence about its safety.
On Capitol Hill, Senate leaders continue to lock heads over that next coronavirus relief bill. Democrats and Republicans are under pressure right now. They're scrambling to reach that deal before the year ends. House Speaker Nancy Pelosi and Senate Minority Leader Chuck Schumer are backing a more than $900 billion stimulus package. Now, Mitch McConnell released his own $500 billion plan today. Each side accused each other of wasting time.
The time has come for Congress to pass a bipartisan COVID relief bill that meets the needs of our workers, our families, our schools, and our businesses.
But here in Washington, the additional relief that would help families, workers, schools, and small businesses cross the finish line has been held up for months while Democrat leaders pursued an all-or-nothing approach.
Now, McConnell's plan includes Paycheck Protection Program funding, money for education and vaccine distribution. Democrats back the provisions except for the COVID-19 liability protections for businesses and universities.